Hello, we are here with Dr. Elizabeth Dineen, a cardiologist at the Mayo Clinic in Florida. Thank you for joining me today. I was just going to ask you, can you tell us about your background, educational wise, what you do as a cardiologist at the Mayo Clinic? And then, this is the firefighter research program. So what got you interested in this population, the tactical athlete population, and yeah.
Absolutely. Thank you so much for having me today. Excited to be here. So I kind of got into medicine through kinesiology in undergrad, and then went through medical training at A.T. Still University, Kirksville College of Osteopathic Medicine in rural Missouri. Kind of had a variety of interests, but kind of always focused back on exercise physiology, and was really drawn to cardiology for that reason, and exercise stress testing. Growing up as a runner, I've always been sort of interested in that exercise physiology piece and realized there was a discipline of sports cardiology that was kind of unfolding as I was going through training. So I was fortunate to be able to have exposure to some sports and exercise cardiologists, as I did internal medicine at Cleveland Clinic, and then cardiology fellowship at Scripps Clinic in California. And through a period of years, I've now kind of found myself here at Mayo Clinic, Florida, practicing preventive, women's heart, and sports cardiology. I supervise a lot of exercise stress tests, and read echocardiograms, and have really focused on taking care of any sort of athlete or highly active person, and through that, a category of athlete that hasn't been as perhaps as well described as the competitive athlete, but has been around obviously for quite some time, as the tactical athlete, as some might call it, military, fire, law enforcement, astronauts. And so, a vital piece of people who are performing these tasks as part of their occupation, putting really intense demands on their body, from a cardiovascular potential strain perspective. And so I found my husband was active duty at the military as I was going through fellowship. And so I had a particular interest in this. Coupled with one of my mentors, Dr. Ben Levine, works with a lot of different tactical athlete groups, including NASA and other astronauts. And so we've kind of come together over the course of a couple years and trying to highlight care of the tactical athlete and potentially gaps in research. So it's been sort of an interest that's developed over time, and starting to get more involved with the fire community here in Jacksonville.
That's awesome. I just learned so much about you that I didn't know. And you really don't think about astronauts as like, whenever I think of tactical athletes, I don't include them in my head. So that's
Yeah.
very cool. Okay, so you mentioned what tactical athletes are. What are some main differences between this group, this population, and competitive, sports athletes?
Yeah, that's a great question. And to focus on that definition, or differences, some have outlined a couple. So one, primary at the start, is that the tactical athletes have a focus on service rather than competition. They're often performing under life-threatening conditions, perhaps while carrying heavy gear and equipment, or during environmental extremes like heat, cold, altitude, or other weather. Some thoughts about the tactical athlete is that there's a high demand for speed, strength, agility, and endurance, but usually in burst-like activity. So, might be just waiting for a call, not very unlike sort of a game, a competitive athlete game, where you have a very defined time period of performance or training. Um, and another big one to think about is the outcome of the tactical athlete's mission impacts the survival of the athlete, the mission, others, and not just sort of the score of the game. So those are some key differences that have been outlined.
Oh, awesome. Yeah, I mean, yeah, you definitely can see the differences and um, just the different types of stress, mentally, emotionally, and physically. Um,
Absolutely.
so you have you're a cardiologist and you look at all these different, cardiovascular strains, and of course this population is under a lot of that. You've mentioned cardiovascular strain amplifiers. Can
Mhm.
you talk about what that is, break it down, and then in context of the environmental exposures and stressors that firefighters and different tactical athletes, are impacted by?
Absolutely. Yeah. And I think to highlight the cardiovascular strain amplifiers, a good framework to start with, there's a chart in the ACC/AHA competitive athlete scientific statement on cardiac care of the competitive athlete. And we are coming out with a similar document, but focused on the cardiovascular care of the tactical athlete. So while the diagram hasn't been published yet, it's the framework from the competitive athlete is what we are starting with, which there's a chart that identifies certain sports, but in this case, tactical tasks for the tactical athlete and what kind of strain they put on the cardiovascular system from an endurance perspective. If you think about potentially like percentage of VO2 max or kind of the aerobic component of exercise from kind of lower to higher. And then also the strength-based component. So what kind of percentage of muscle contraction is required and what intensity for that sport, but in this case for the tactical tasks. And so those get put on a diagram so that as cardiologists or other care providers that are looking at certain testing for the tactical athlete might understand what the demands might be required of, is it a low endurance, low strength activity? Is it a high endurance, high strength activity? So when you start inputting someone's underlying cardiovascular risk or their underlying medical condition or other cardiovascular disease, what do we think that they could withstand with those tactical tasks in mind? So there will be a better framework for that when this is published. But the idea of the cardiovascular strain amplifiers is then building on that chart. And some have potentially described mild, moderate, and high cardiovascular strain amplifiers. And those would be things that would shift you up or down that chart of high strength or high endurance demand on the cardiovascular system. And some thoughts could be as perhaps as simple as, or maybe not as simple, but, even baseline nutrition, hydration status, what sleep or interrupted sleep patterns there are, because those can have impact on the cardiovascular system, all the way to different environmental conditions, performing work in high heat index areas or at altitude, and certainly wearing all of the gear that firefighters and other tactical athletes wear when performing these activities. Really into mission completion, not just stopping when they, feel like they need to necessarily, but really kind of giving it their all in that setting. Even things like not having warm up before, like if you're called, you're heading out. That's considered potentially a cardiovascular strain amplifier. So, it's a really interesting concept that we and others think are trying to introduce so that it can guide the risk discussion when you have risk or disease to say, oh, they could maybe, carry that ruck while having a certain amount of load, or respond to an alarm, or even performing CPR and things like that, as you're sort of risk stratifying people.
That sounds very helpful. It sounds like the chart would really need to be quite comprehensive. Will it be digital or will it be just in a picture
Yeah,
form?
that's a good question. Initially, it will be sort of housed it'll be co-published hopefully in our American Heart Association journal Circulation, and then American College of Cardiology journal JAC, or Journal of American College of Cardiology. So those will be available online, but I don't know if those will be made into infographics or available in
Yeah.
other avenues later.
Well, what I'll do is I'll once that is published,
Yeah.
I'll add it to the notes of this video.
Oh,
That way,
great.
whoever watches this, if it's published, it'll be down there. Maybe I'll even add so you said the one with the competitive athletes is already published,
It
just for an
is.
example.
Yeah,
Okay.
that one just came out in February or March of this year. The
Okay.
primary author is Jonathan Kim on that, and that's a really nice updated document. Um, and um, it's kind of higher level clinical considerations, but the plan is to have even more in-depth explanations with lots more references and data to support every individual task force, published in the MSSE journal, hopefully later this year. And we'll do the same, hopefully, with the tactical athlete. So it'll kind of be a
Okay.
layered approach of sort of recommendations and the data behind it. Although it turns out that we still probably need a lot more data to guide
Oh yeah.
recommendations.
Right. Well, at least it's starting somewhere because, you want your doctor to be able to understand what you're doing. And so this will be at least a starting point. That's great.
Absolutely.
Okay, so you mentioned like, going for testing. So what if you were a firefighter or,
Mhm.
some type of tactical athlete, what would you suggest they do yearly, or just what needs to be monitored to make sure there are no underlying conditions to prevent future, issues?
Yeah, so yeah, great question. And I think especially because another difference I think with the competitive athlete and the tactical athlete is that for the tactical athlete, this could be for decades. And as we start aging, cardiovascular disease becomes more prevalent, and so the recommendations are potentially more stringent or just different. And so, uh, we might not have kind of like a one size fits all. Obviously, there's, different guidance from the NFPA, different iterations, and we've got other firefighter organizations to kind of guide. I know the Wellness Fitness Initiative is being updated. So I know there's layers to kind of recommendations for health and wellness. Um, but overall, a kind of a thought, it's not clearly well defined yet, but we know that firefighters and other tactical athletes need to perform, a certain level of fitness. And hopefully, over time, we kind of eliminate the tests, the stress tests that are just limited to, oh, you got to 85% of max predicted heart rate, or you got to 12 METs on a treadmill, or you reported to us that you're fit. Hopefully we get even more refined to maybe not annual, but maybe based on underlying risk. I think a lot of it needs to be guided based on what is someone's underlying risk, what is their blood pressure, cholesterol, family history, age, tobacco status, diabetes status, all of those things to guide the discussion of would a stress test at this juncture be helpful, more than just at accession and then at certain periods. But the thought is that maybe like a customized maximal effort stress test. Some people say that maybe it should be refined and tailored to the tactical task. We don't necessarily have perhaps a robust data to support that. And I don't know outside of research labs, how many are actually, doing tactical task specific stress tests to guide, further cardiac testing, but I think in theory, a lot of people are trying to kind of consider suggesting that, or at least researching that, so that we understand what are the actual cardiovascular fitness levels and demands of those specific tasks. So I think one, starting with the baseline cardiovascular risk, there's a lot of different equations that we use that input those risk factors that we talked about just now. And then I think if someone's intermediate risk, then we're often also using a coronary calcium score to see if someone has like underlying coronary plaque. That then guides discussions about cholesterol agents and additional potential stress testing. And I think the knowledge of the risk also helps us engage in other healthy lifestyle choices if possible, understanding that shift work, long shifts, high stress doesn't necessarily always easily support, the best nutrition. And there's a lot of caffeine and poor sleep. It sometimes there's a perfect storm there, but at any rate, underlying risk, coronary calcium score for at least intermediate risk people. And sometimes people are doing that even over the age of 40 for a baseline test for tactical athletes. Often people are recommending an electrocardiogram at baseline consideration for tactical athletes, at least can consider, not necessarily a should for everyone. And then I think the customized stress test, I think if we could get to that point, and knowing, what type of stress test for different tactical athletes would be helpful. I think as it is now, it's variable at the different stations, even across even individual states, depending on resources and whatever the current protocols are. It's just not super standardized. So I think we have a little bit of work to do to research this and to understand what's best. But because cardiac disease is unfortunately still prevalent and causing more sudden cardiac death than we would expect and hope in the firefighter community and other tactical athletes, I know that we have a lot of work to do.
Yeah, I can just see how complex it is you can't give a one size fits all. It sounds like your hope would be to at least get like yearly blood work done so that then you could know, do extra steps need to be taken, and questionnaire of risk factors.
Yeah, exactly. And at least even having a baseline blood work and then kind of going from there, depending on cholesterol levels and presence or absence of diabetes or some other risk factors. And, I think even blood pressure, isn't potentially as controlled as we would think that it might be, in general in the community, not just tactical athletes. But still in that, that community. And then also, tobacco exposure, globally. But, they're making sure that people are kind of following up with those general risk factors and doing some type of lifestyle intervention, whether it be diet or regular exercise, monitoring blood pressure, those kinds of things.
Yeah. I know that you do a lot of work with wearable monitors. It would be cool. A lot of these watches have heart rate and things like that. It would be cool. I don't know if there's one out there that has blood pressure like that could just be taken continually. That could be worn with fire gear and everything. Not something that, has to be taken off just to see the extremes of how high their blood pressure gets and what it looks like during a fire. I don't think they have that out yet, but it would be really cool.
Time that I know of, I think it would be really helpful. Yeah, we're hoping to, like you said, do some wearable study, just to kind of understand a little bit more of the physiology of on duty versus off duty time periods. See if we can. Be nice to find some signals that we could kind of intervene sooner, rather than sort of on the back end of some of these events.
Yeah. I know you're working on that research, so maybe down the road we'll meet again and talk about any findings. But before we wrap up, you've mentioned already like shift work makes it difficult for sleeping, the diet, caffeine. Is there anything that you suggest would be a good prevention strategy? And also just like doable, because sometimes there's some really great prevention strategies, but the normal person just, especially the firefighter who, or like even the tactical athlete who just doesn't have a lot of control over their day. It's just difficult to implement some of these, you know, um, like I tried to get them to intermittent fast, and that was really difficult because they were afraid they'd be intermittent fasting and be at the end of it, but then be on a call. So then they'd not have any food in them. So it was just like a difficult thing. Is there anything you would suggest that, you think would be a good idea?
Yeah, that I mean that is tough. I, I would say probably if the whatever is easiest access, right? So if the station is able to implement kind of wellness programming and have healthy snacks available. I know some have gym equipment available, but sometimes people are trying to maximize sleep or just relax. But trying to prioritize even in short bits, getting regular aerobic cardiovascular activity. And some people, of course, are doing that. But if they can find even 10 minutes, 20 minutes, and it's on shift or the stations can have those healthy snacks available, it's going to be probably impossible to quite improve the sleep as that is truly job dependent. And it's hard to kind of plan the caffeine and all of that around there. But I think being mindful of risk factors and being empowered by those results. So if someone does have borderline or elevated blood pressure or borderline or elevated blood sugar, kind of keeping track of that and opting for lower sugar or lower salt options for their snacks or diet in general. Not everything needs to be kind of fixed with a medicine, but sometimes even low doses of medication can help bridge the gap while waiting for some of these lifestyle factors to take hold. And then, hopefully we do a better job of identifying high risk individuals. Medicine continues to evolve and improve. And I don't think I have the magic bullet to answer your question officially, but it's a hard task at hand, right? Um, but those, I guess, would be a couple of my recommendations.
No, those are great. I mean, because even in our household, like if there's junk food in the cabinets, it's calling my name. So at a fire station, it would be good, even if the fire department supported healthy snacks in the cabinet, maybe
Absolutely.
even a list of like, don't eat this instead, or
Yes.
something like that. But no, this was very helpful. I think that these are some good suggestions, and hopefully the tactical population and other doctors and researchers may get something from this. Um, they wanted to reach out to you. Would you want them to like contact me and then me put them in touch with you, or is there some, what would you suggest?
Yeah, I think it's okay to put my email in the link to the episode and I can share it here.
Okay.
But it's my last name Dineen dot Elizabeth at mayo.edu. So I'd be happy to be in touch over email.
Awesome. Okay. Well, thank you for that information. I'll
Sure.
put it in the notes as well, and then that article, and then we'll look forward to once you let me know that um, other article gets published. I'll stick it in
Good.
the notes.
Wonderful.
Well,
Well,
thank
thank
you
you.
for taking, yeah, thank you for taking the time.
I appreciate the opportunity.
Okay. Have a good day.
You too.
All right. Bye.